Justin Field. I'm an orthopedic spine surgeon, and the Durango from Lanx is the ALIF of my choice for various reasons. My typical patient that I would be thinking about doing an ALIF on is a patient with degenerative disc disease. Perhaps they've had a discectomy before, a laminectomy, and they get recurrent stenosis with a preponderance of back pain with leg pain as well. And after conservative treatment has failed, these are ideal candidates. There's obviously many options out there, many companies that have standalone ALIF devices, but I prefer Durango for many reasons. One of them is its versatility. It's the only one out there on the market that has an option of zero profile, a half plate, and a full plate. And this is really important because intraoperatively the vessels, the aorta, the vena cava, and their branches, the common iliac veins and arteries, can be in areas that make it difficult to fully access and get great exposure. For those patients with, I'd say, grade 1 spondylolisthesis or less with the clinical presentation, I've been really pleased with the fact that I've been able to do a standalone Durango device with them with the zero profile. However, I've certainly had patients who have much more instability. In those situations, I've used the half plate and I've used the full plate. What's really important about that is, with the full plate and half plate, is it's actually gives them a more robust, immediate rigidity. The other thing is I like that I prefer about the Durango versus other products is that they have a plate on the front, and this is also improves its stability, but it also makes it so that the screws can't back out, which would be very problematic, them backing out into important vital structures. And there is a lot of other companies that don't have that option. I will get posterior stability through either pedicle screws or with the Aspen or L-plate design. I actually prefer the Aspen or L-plate design for patients who aren't, if it's above L5S1. So for my usual patient at L4-5, just because it's extra fluoroscopy time, putting in pedicle screws, extra time on the operating room for patients, and actually by making a nice small midline incision, I'm able to decompress in there as well, do a midline decompression, and add the stability there without having to expose out to the transverse processes or way lateral to the facet joints. A great example of a case where I wanted to use the Durango as well as backing it up posteriorly with the L-plate is my patient Julie, very active woman who enjoys playing tennis and is very active in her community. We decided, with all the conservative treatment that she had, surgery was our next option. The big concern that she had is how she was going to do post-operatively, how quick she was going to return to the activities, that she really enjoyed. Doing a big surgery through the back, where we'd have to disrupt the musculature, was something that she really wanted to avoid. She did great. She left 2 days after surgery and was walking miles and miles, a day right after surgery. We got her into physical therapy, and at this point she's playing tennis again. She's 6 months out from surgery and very pleased with the results. She had immediate relief in her back pain, and within a week or two, all of her leg pain that was there preoperatively was gone.
Dr. Field mentioned to me when I went in for my appointment, my consult, that I would probably need an ALIF, which is an anterior approach to the vertebral bodies. My surgery was 100% successful. I don't have stars in my eyes thinking that everything is going to be perfect. I know surgery sometimes comes with changes. I don't feel like I've had to make too many, but having been through the surgery and the recovery period, the initial recovery period was very minimal. on my back. I almost forgot I had back surgery.
Laura is a very, very active woman. She's a nurse in an intensive care unit and also in the ER, and is also very into running and sports. So she's just active 24/7. And unfortunately, she not only had a spondylolisthesis at L5-S1, but she also had a humongous extruded herniated disc that at least was at the same level as the disc. And so for a patient like this to get her back to work, she really loves her job as a nurse, but also back to her activity she loves to do when she's not at work. I felt that the Durango was perfect for her situation.
I guess I feel very fortunate that I found a surgeon who is very much on the cutting edge of technology, and that he knew the option of the Durango was out there and recommended it for me. He was really good about explaining the ALIF to me, telling me that it was from a front approach and that it would make it so it was very easy for him to reduce the spondylolisthesis and insert the Durango cage without having to disrupt any of the nerves from the back. Durango was just a really good option for me because of my situation. The pedicles that I have in my L5 are very narrow, and with this type of cage, it just has the screws that go up into the upper vertebrae and the lower vertebrae, and you have very little hardware in there, so it really worked out well for me. No regrets at all. I think that people have a lot of options out there, and they need to go and research it and find someone who is on the cutting edge of technology and make sure that they're going to have a good outcome.
I'd say these are some of my happiest patients in clinic. I'm not worried about them not fusing. These patients are fusing, a little after 6 months, just right on schedule. I mean, we're talking about 2 pretty small incisions. It's quicker recovery time. They're not on the operating room table for a long time, and most of my patients go home the next day or the day after. So these are very short hospital stays, which benefits certainly everybody.